le lenti
Phakic
Phakic.
lenses are implanted inside the eye and have the function of eliminating the visual defect. This type of lens is introduced into the eyeball by making a small opening and goes to position itself in that visual space that is behind the iris and in front of the lens. This lens is inserted in this small space, which has the appearance of a contact lens. But unlike the latter, instead of being placed on the corneal surface, the surgeon inserts the special contact lens inside the eye. It is invisible to the outside, stable, and has the power that interests us to correct the patient's visual defect. It is not a lens that must be removed in the evening, not necessary to carry out maintenance, does not require cleaning, but it is a lens made to remain inside the eye throughout one's life. All this does not mean that one day it cannot be removed. If cataract or any type of eye problem comes, the lens can be removed, so it is a reversible kind of surgery. We do not touch the cornea, unlike in laser. Therefore, we do not take away any tissue. We do not touch the lens or the vitreous. The eye remains unchanged with no problems with corneal thinning and eye pressure, which often happens after surgery or any changes in the curvature of the cornea. We do not remove the lens, and this is a very important aspect because it is risky to remove the transparent lens in a myopic eye of a young patient. The risks of retinal detachment are concrete. Therefore, the implantation of a phakic lens is very conservative. These lenses also have filters for ultraviolet rays. Therefore, they preserve the lens and the retina. They are lenses that mimic the use of filtered sunglasses, so it is like having to wear them all day long. The posterior chamber phakic lenses, or implantable columnar lens, has a million implants on their shoulders. In almost 25 years, none of these lenses have ever been explanted because of the lens itself, and this means that it is an extremely safe kind of lens. The material of which it is made starts from porcine collagen, a material that has been 100% biocompatible since the first implant. The shape that these lenses have assumed has evolved over time, and therefore they have become more compatible with the shape of the eye. The company has developed an improvement in shape. The experience is unmatched, and no other company in the world was able to have these results of implanting in a million eyes with 100% biocompatible material. The market is moving in this direction in other countries, so we, in Italy, are also going in the direction of conservative refractive surgery for the cornea, the crystalline lens, and the whole eye. After the posterior chamber phakic lens implantation, the patient is under rehabilitation in a maximum of 24 to 36 hours. It is a pain free surgery. The quality of vision is immediately good the next day and continues to grow in the following days. Usually, an implant is made from one eye, and then the following week, the implant is made on the other. Bilateral implants can be made in selected cases. Some patients have reported temporary halos around lights at night. This scenario is explained well to the patient because otherwise he or she might be surprised or scared. These halos are destined to be eliminated by the human brain with a neuroadaptation mechanism, and the time varies from 3 to 4 weeks. After 2 months, 90% of patients no longer see them definitively. This is the only significant side effect of this lens, apart from seeing very well, never having ailments, and to go back to the ophthalmologist.